Well, spring is certainly in the air, and as the temperatures start to rise, it's a good time to get out and start jogging, taking your kids to the park, and maybe even working around the yard. But if you've been cooped up all winter long and you haven't stayed active, now is a time when you really can suffer from some bone and joint pain. So we're going to give you some tips on how to prevent injury with Dr. Nick Shamie, who's an orthopedic specialist. He joins us this morning. Hello, doctor.
Hello, Andrea. How are you?
Oh, I'm terrific. I'm terrific. We're starting to have some great weather here in Cleveland, even though it's raining today. But I find that when the weather starts to warm up, it's great around here because people are outside and they're definitely more active. But do you notice that there are more injuries happening as weather starts to warm up and people are outdoors?
Absolutely. With the excitement of good weather comes the excitement of wanting to get back in shape, and that can sometimes get you in trouble, because if we've been cooped up, as you said, over the winter months and we want to suddenly become active, we're going to do too much too early. So my advice to you is to start gradually. Start with 5 minutes a day, go to 10 minutes, and all the way up to 20, 30 minutes a day to get your bone and joints used to the new activity level that you're doing. So I think starting gradually is the way to go.
Which is easier said than done. We get so excited when the weather warms up that we think, oh, I don't want to just do this for 5 minutes. I'm feeling like I could go for a good hour power walk with the sunshine out.
I agree.
Are there other things that we can do, though, in terms of strengthening our bones and helping our joints in terms of foods or medications or vitamins?
Yes, another thing I wanted to mention is I think stretching before you go out and do a quick run is important. But like you said, there are other things like taking care that you have a good, healthy diet, and also a diet that's supplemented with vitamins and other supplements. Because a lot of times when we have even a healthy diet, we're lacking on some key things. For example, a good dose of calcium, which is lacking for most of our diets. So having a good supplement of vitamins and minerals, including calcium, and for the bone and joints, glucosamine chondroitin sulfate, which could help with those occasional aches and pains, could really help you avoid injury.
Yeah, what is your feeling on glucosamine? I've heard about that for joint pain. Are there studies that show that it really works? And how much do you have to take?
I think, there's definitely studies that show that it works, and I have patients who tell me that they're better after they take it. You have to take it for a few weeks before you start seeing the results. And there are various different brands out there that you can take, and there's instructions based on the dosing for each brand. So I would just follow the recommended dose and take it for a few weeks before you start noticing some results. But it certainly can help with bone and joint pain. When it becomes more serious and the aches are more chronic, that's when you want to see your specialist before you take your health into your own hands.
Yeah, it's always good to talk to your doctor. Are there references online? Is there a certain site that you would recommend people go to do the research?
Absolutely. We have a great website, lifesupplemented.org, which gives you a lot of this information that we're talking about. And also there's a wellness scorecard, and it's a 5-minute test that you can take to give you an idea where you stand in these 3 pillars of health, of good, healthy diet, well-supplemented diet with vitamins and supplemented minerals, and also a good, healthy exercise. And it's a good way to find out where you stand.
All right. Well, Dr. Nick Shamie, thank you so much for joining us this morning with that advice.
Thank you, Andrea.